to issues like itching or swelling.
On 3? Yes. 1, 2, 3. Okay, is there anything else? That's it, thank you.
The RN will now complete the last portion of the head-to-toe assessment by assessing any musculoskeletal needs and complaints of the patient. The musculoskeletal assessment consists of the following: motor strength, upper and lower extremities, hand grips and pedal pushes, gait, range of motion, mobility needs, and any complaints of pain, weakness, numbness, or tingling sensations.
You having any pain or numbness or tingling? Press against me. Does that hurt?
In my left foot.
Okay, that's where your surgery was at. Okay, the physical therapist will be coming in later to assess your physical therapy needs, and they're going to be going over some exercises with you. They're called range of motion exercises, okay?
All right, good. Can I get a pain pill?
Sure, most definitely. Tracy, the LVN, will come in and give you all your medications and stuff like that, okay?
All right.
Is there anything else that you need?
No, thank you.
Okay, now that's going to conclude my assessment.
All right.
All right, thank you. I'm going to go ahead and fix you back in bed before I leave.
The RN will document all of her findings, and if anything unusual is found, she will report it to the doctor. With this initial head-to-toe assessment, the RN has the information necessary to evaluate and set up a care plan for the patient. Now that the patient has been assessed and the RN has established the care plan, the patient can begin her rehabilitation program. One of the most vital parts of this process is the pain management and the importance of administering medications properly. In this scene, the LVN will be administering routine medications and assessing for pain. Also, a student nurse and instructor will be helping the LVN with the administration management and providing patient teaching.
Hello, come in. Hello, Tanya. I'm Tracy, your LVN. I'm going to be caring for you and giving you some medications.
Tracy.
I brought a student in with me today and his instructor. His name is Tyson and his name is Keisha.
Good morning.
Okay, I have your blood pressure medication, metoprolol. I also have glucophage for your diabetes and Ativan to help you relax. I'll be giving you an injection of Lovenox. It's to help reduce blood clots, prevent blood clots.
Okay, this medication is, like she said, to prevent blood clots. So I'm going to just go ahead and talk to you a little bit about the medication. Have you ever had it before?
No.
Okay, so it's going to go in your belly, and you might see some bruising. That's normal. What you don't want to see is bleeding from your gums. So when you're brushing your teeth or you're eating and stuff like that, if you notice bleeding, go ahead and give your doctor a call, okay?
So I have to have this shot?
This shot is to help you from preventing blood clots, okay? Because you're going to be in bed for a while with your hip fracture.
Okay, I'm going to check your wristband. Let me wash my hands first, and then I'll check your wristband and ask you who you are to make sure I'm giving you the right medications. Okay? Can
All
you tell me your
right.
first
I don't like
name?
shots, though.
The LVN
My
will
name
now
is
check the
Tanya
patient.
Thomas. I was born 11/22nd, 1940.
Thank you.
The LVN will now check the patient's identifiers before administering medications to the patient. The LVN will also check to make sure that the medications have not expired and that the doses are correct according to the MAR. She has already verified the doctor's orders in the patient's chart prior to entering the room. Also, the LVN has assessed the patient for any swallowing problems or preferences in taking her medications, like for instance with applesauce or crushed. She also needs to make sure that the patient has fresh, clean water. She washes her hands before administering the medication and provides for the patient's privacy.
Okay, Tanya, can you tell me if you have any problems swallowing? When you take pills, can you take them? Do you get them crushed?
No, I can swallow my pills just fine.
Okay, great. Okay, I'm going to give you your pills and your water.
All right, thank you.
Okay. And then I'm going to give you a Lovenox shot. It's going to go in your stomach, as we discussed before. It's just
Right
gonna
in
be a
my
little-
stomach.
It's just going to be a little pinch.
The LVN will now assess the patient for pain. She will assess for the patient's risk for pain, the location, the character, and the amount of pain on a 1 to 10 scale.
Okay, are you in any pain right now?
Yes.
Okay, on a scale, 0 being the least and 10 being the most, where would you describe your pain?
My pain is in my hip, and it's a 4 or 5.
Okay, and is it radiating? Is it?
Yes. Well, it stays in my hip and mostly in the same spot.
The nurse examines
don't
the
wanna
site for
move.
the pain or discomfort to make sure there are not any other factors contributing to the pain.
Okay, Tanya, we're going to allow Tyson. Would you like the experience to give pain medication?
Yes, I would. I'm gonna go check the orders and the medication. I'll be right back.
Okay.
The student and the instructor return with the medication and will again check the patient identifiers before administering the medication. The student washes his hands and provides for privacy.
Go ahead and wash your hands, please.
Okay, Miss Tanya, I have your pain medication. It's a Vicodin. Can you state your first and last name and your date of birth?
11/22nd, 1940, Tanya Thomas.
Okay, Tyson, so now that you've checked the MAR and you've checked to make sure that the medication is not expired, when we got it from the Pixis, you may go ahead and give the medication to her now.
Okay, I'm gonna double check the wristband just to be safe against the mark. Okay, and everything looks good. Here's your Vicodin.
All right, thank you.
You're welcome.
The student will document the time the medication was given on the medication administration record, or the MAR. In 30 minutes, the LVN and the student will return to assess the effectiveness of the medication. The LVN will document her assessment and whether or not the medication worked.
Good morning, Miss Tanya.
Hello.
How does that Vicodin working for you that I gave you a half hour ago? What's your pain level on a scale of 1 to 10, 0 being none and 10 being the worst pain you've ever experienced?
It's better. It's about a 2 now.
Awesome. I'm very glad this worked out for us.
Thank you.
When the nurse leaves the room, she makes sure that the bed is in the low position and that the call light is within reach of the patient.
Okay, here's your call light. If you need anything, give me a call and I'll just be right in.
All right, thank you.
Another big part of the rehabilitation program for Tanya is physical therapy. For the most part, after a fracture, doctors usually order physical therapy as part of their plan of care. In this scene, the patient will be greeted by a physical therapist that will assist the patient with range of motion exercises that the patient has to perform prior to beginning the process of physical therapy. The physical therapist washes her hands and provides for privacy.
Hi, Tanya. My name is Sherry Martineau. I'm your physical therapist. I'm going to be working with you today to provide you an exercise program to help strengthen your left hip, okay?
Okay, hello Sherry. I've been really excited to be working with you. I can't wait to start walking so I can go home and get out of this place.
Okay, good. And that's what we're looking for, to get you better so you can go home and perform these activities on your own, okay?
Great.
So I'm going to wash my hands. Can I just